According to the American College of Sports Medicine, there are 8 risk factors that determine a person's level of cardiovascular health. Let's take a quick look at each one. Age. Men older than 45 years and women older than 55 years have increased risk of cardiovascular disease. As we age, risk of cardiovascular disease increases. Statistically, men tend to get cardiovascular disease earlier than women, whose cardiovascular risk increases with the onset of menopause. Family history of heart disease. This includes myocardial infarction, angioplasty, death related to cardiovascular disease before 55 in men or 65 in women, who are in the client's immediate family, meaning father, mother, brother or sister, son or daughter. Smoking. People who are currently smoking or quit within the last 6 months gain a risk factor point towards cardiovascular disease. This category also includes people who are exposed to tobacco smoke environmentally, which is also known as passive smoking. Sedentary lifestyle. Sedentary lifestyle is defined as not participating in at least 30 minutes of moderate intensity exercise at least 3 times a week for the past 3 months. Obesity. Obesity is defined as having a BMI of greater than 30 or a waist girth of greater than 102 centimetres in men or 88 centimetres in women. Be aware that BMI can be relatively inaccurate with heavier built populations such as Pacific Islanders and lighter built populations such as Asians. So a lean, healthy and fit Samoan Islander could have a BMI of 32 and an overweight Japanese person could have a BMI of 23. When BMI is considered to be inaccurate, other measures may include waist girth and waist to hip ratio. Hypertension. Systolic blood pressure greater than 140 or diastolic blood pressure greater than 90 confirmed on 2 separate occasions, or known hypertension with a client on antihypertensive medication gains a risk factor point. Hypertension is not something you feel, and many people have hypertension but don't know it. When a client sees you for the first time, they may not have had their blood pressure measured for years. If you find your client has blood pressure greater than 140 over 90, it's important to send them to the doctor for clearance to start an exercise program. DYSLIPIDEMia refers to the amount of cholesterol found in the blood. There are 2 types of cholesterol: LDL, or low-density lipoprotein, and HDL, or high-density lipoprotein. HDL is good to have in the bloodstream. It cleans up your arteries. And LDL is bad cholesterol, which leaves plaque deposits on your artery walls. To remember which cholesterol is good and which is bad, think of LDL as lousy density lipoprotein and HDL as happy density lipoprotein. To get the measures for cholesterol, your client will need a blood lipid profile performed by the doctor. Knowing your client's cholesterol level assists you in determining the cardiovascular disease risk. Pre-diabetes. Impaired fasting glucose indicates resistance to insulin, which is released to transport glucose from the bloodstream into the muscles for use as fuel. This pre-diabetic state is related to type 2 diabetes mellitus and increased coronary risk. As in cholesterol, the test for fasting glucose is normally provided by a GP or endocrinologist. So there you have it. Each one of these risk factors measures the likelihood of having a coronary or cardiovascular related event or illness. For every point scored in positive risk factors, the more likely your client is to have a heart attack or suffer from some form of metabolic disease. Negative risk factors reduce this risk by providing a protective function. The only negative risk factor is having a high level of high-density lipoprotein in the blood. This good form of cholesterol helps to keep the arteries healthy and clear of plaque buildup. Simply put, the positive risk factors are added up to determine the risk. More positive risk factors mean more risk. Negative risk factors are subtracted from the positive risk factor score to reduce the risk of cardiovascular disease. Risk stratification. After adding up the client's risk score using the Fitness Australia screening tool, we can categorise the client into low, moderate, or high risk. Low risk means none or only one risk factor, which may be something out of your control, such as age or family history. Moderate risk. 2 or more risk factors, but no known disease. For example, a person may be a smoker and have a family history of heart disease. This would be a great reason to give up smoking. High risk is when someone has known disease, such as hypertension, dyslipidemia, type 2 diabetes, or coronary artery disease. Where a client sits on the risk profile determines the intensity they are cleared to work at. Moderate risk clients are cleared for moderate intensity exercise, yet require medical clearance for vigorous intensities. High risk clients require clearance for both moderate and vigorous intensity exercise. Failure to get clearance increases the liability to your business and may lead to unfortunate events for your clients. So be diligent with your paperwork.